Hi everyone, I'm John Lynn, the founder and chief editor at Healthcare IT Today. We're excited to bring you another in our series of interviews with top leaders in health IT. And today's guest is Bill Charnetski. He's the Executive Vice President of Health System Solutions and Government Affairs at PointClickCare. Welcome, Bill.
Thank you.
Yeah, so tell us a little bit about yourself and PointClickCare.
Well, PointClickCare is started by providing electronic health records into the skilled nursing facilities or long-term care homes, as well as retirement homes, assisted living, senior living. But now we are maybe the only connected care network that connects nodes of the health system from ACOs and hospitals and health plans and health information exchanges right through to the long-term post-acute space. So, allowing bi-directional data flow in both directions.
Yeah, and I think we want to talk about that expansion a little bit, but I think let's start with the LTPAC, the long-term post-acute care, the post-acute care space, and how has it been impacted by the lack of investment in technology? And quite frankly, they were left out of the incentives, the $36 billion that went to acute care and ambulatory care. Talk about that. How have they been impacted? Where are they at? What's the state of kind of adoption of technology?
Yeah, I my career has had me in law, government, and business, but included about 10 years at AstraZeneca, including running the global government affairs team for AstraZeneca of London, England. So I watched how shaping public policy can really make a difference in lots of ways we could talk about. But one of them was that sector, to pick one, as the acute care sector did around the time of the Affordable Care Act, was able to articulate crisply what an investment in health information technology can do. And that resulted in hundreds of millions, if not billions of dollars into those sectors. That never happened for long-term post-acute care. And that's a big gap. It's also a massive opportunity, and I'm happy to talk more about that. But I think more than anything else, when you're looking at the power of shaping public policy and the impact, positive or negative, that can have on a health sector, that example is probably the most telling one.
Yeah, no, absolutely. I'm kind of two views of it. Like, in some ways, they should be grateful they didn't get forced into slamming EHRs into their system as quickly as they could without business thought in mind. Yeah. And on the other hand, many of them haven't invested, and so it's not digital. And so, at least in other areas, it's digital, so you can start leveraging AI and some of those things. So I see both sides of it. But let's talk about that, right? I mean, what is the case for these, post-acute care organizations to adopt technologies, even without the government incentives to do so?
Yeah, well, I think they can come in, the way that they affect the operation of the individual skilled nursing facilities or, ALRSL facilities. And then there's also kind of a next level where you look at the systematic or health system impact of either investment or lack thereof. For the individual skilled nursing facility, for example, pre-pandemic staffing was a challenge. Post-pandemic, it is an immense challenge for them. So if you just simply look, as every other sector has, now that we're in 2022, almost 23, at the the need to invest in innovation and technology in addition to capital and labor, as being the only way you can get an optimal investment of resources for optimal outcome. In other words, if you just keep investing in beds and staffing and think that we're going to solve the problems that existed before the pandemic and have been exacerbated by the pandemic, we're not going to get there. So we need to invest in the three components: beds, staffing, and innovation / technology. Why? Well, technology, will make things go more easily. They'll require less human resource to accomplish particular tasks. And we can talk a little bit about that. It also, if you even just broaden the scope to look at ACOs, for example, you can use technology to reduce the readmissions of patients, who are discharged from hospitals into SNFs, and then, they're dependent on records that often are stapled to the gurneys of these poor folks. Then that data is input by hand, which people are people, leads to errors, leads to readmissions into the hospital, and it's just a really a suboptimal investment of resources for everybody in the system, but terrible for the patient/resident, and really inopportune for the people running the homes. So that's an example of how you can look at advantages to the home, or disadvantages, I guess, for not being invested or not investing in technology. But then you start to get to broader systemic impacts, at least if you're looking at the ACO scope.
Yeah, well, and I think that's the thing that resonates to me, is that this lack of interoperability and being able to share data with the acute care is going to catch up with these, post-acute care facilities, because the acute care is going to say, "Oh, I'm going to just work with the ones we can interoperate." Yeah. Is that how you kind of look at it?
So we can talk about the SNF, or the home level. We can talk about the ACO level. Now, if we look at the health system as a whole, it's characterized by three things that can be addressed by investment in innovation or technology. One is the lack of interoperability, as you say. Like, we do not have the ability to move data smoothly across the different nodes or sections of the health system. Secondly, that just exacerbates the fragmentation. I mean, you can do a whole show on the siloed health system. Sure. But if we can't, we have the ability to start to break through those silos with this type of movement of data. And then last, or the thing I was talking about before, namely, there are just better health outcomes available for having data move more freely, including amongst and between the long-term care, post-acute long-term care homes. So if you put all that together, and by the way, that's equally applicable in generally privately funded system like the United States has. It is very applicable and important in publicly funded systems like Canada or the rest of the world, because if you have the strategic and funding decisions made from a central. So if you pick a province in Canada, for example, where you have a single payer publicly funded system, the funding emanates from the center. Sure. So in theory, you want the optimal investment of resources, human and time, energy, and money, and you really should be making that assessment on the basis of a system as a whole. But even in privately funded systems like the U.S., there's an increasing amount of public dollars coming in. And if you're CMS or ONC, I would have thought, you would really want to ensure, again, I keep coming back to optimal investment of resources, which won't come unless we get at those three issues.
I think it's interesting to look at too. I was going to ask you, should there be incentive to share between post-acute care and acute care? But there kind of is. There's this thing called hospital readmissions that every single hospital and health system understands to the letter. So I guess there's kind of incentives, or should there be other incentives to really do this sharing?
So I'll tell you. For people who are familiar with the Canadian system, for example, the government of Ontario, which is Canada's largest province, so it's a almost 16 million person system. Yeah. That would be the 5th most populous state in the United States, if it were the United States. So that's again, publicly funded, emanating from the center. And even they have, where there isn't really a financial incentives for individual hospitals or hospital networks to join up, even they have realized that how impactful it could be to connect hospitals with, they call them long-term care homes in Canada, but skilled nursing facilities, right? It's that home, like the potential, the upside, the potential of connecting them together is huge, because it gets at the kinds of things we're talking about. In the US, again, when you got on the public side, you really want to have that connectivity, whether there's sticks or carrots or not. If you're writing that big check out of the government agency for for Medicare or Medicaid at the state level, you should care, right? Like if you're a taxpayer, you want them to care. They are running the agencies as well as they can. They should care. And that's even before you get to sticks and carrots, because there's a whole nother layer, as we saw in the Affordable Care Act, more than a decade ago, where they started to have more sticks, I guess, than carrots, except there was a lot of funding attached. And that's the last piece of this, is we can talk about what the system should do without incentives, but as in the LTPAC sector, these are thin margins and already overburdened people. Sure. So the notion that it's easy for them to quote unquote invest without some kind of health information technology incentive funding, I think is misplaced. Again, if we accept for the moment that it's something that should happen, it seems unlikely to happen on the scale that would be required by the policymakers, or at least sought by the policymakers, unless they have some funding attached to it. There is not the money. Again, so that was the case pre-pandemic, certainly the case post-pandemic in LTPAC to make this happen on its own.
And what do you see being done in Washington? I know you work with the government affairs to kind of ensure that LTPAC and the post-acute care isn't left behind, some of these regulations. I mean, I thought your comments on stage here, at the PointClickCare Summit were interesting as far as we know more regulations coming. Yeah. But can it be sensible? That felt like what was your plea, right?
So first, I'm glad you're listening. That's awesome. No, but seriously, what you heard me say, and I think others maybe who are watching this have heard me say, is something along the lines of the LTPAC sector isn't fully understood
that's fair.
By policymakers, elected and officials and agencies like CMS and ONC, which is not to be critical of anyone. It's just that the focus of the health sector has been on the acute side, frankly. And so what we want to help people get to is, our sequence, which you heard me say, was, so we feel that our aim is to become a trusted advisor to ONC and CMS here. When it comes to data and data insights for the senior care sector, the LTPAC sector. And the sequence we take people through is, first of all, let us help you understand it, right? I think as we saw in info blocking, now info sharing, it felt a little bit like you took an acute care model and turned it kind of 5 degrees to the right and said, okay, this will work for LTPAC. And to the agency's credit, they reached out to us to help our sector understand it better. We co-hosted webinars with folks from the ONC, for example. So people are open to this, to this increased understanding. But that has to happen. And so that's education. We then, we show how the data and data insights that come from senior care is an untapped resource, right? There's huge potential for just using that information, those insights, to understand what the sector is and really in real time, what it could be, which gets to the third point, and is what you're referring to. It's a peak of honesty. We say, okay, so we know regulation is coming, more regulation, not just in SNF. I think in senior living and assisted living, right? Absolutely. And if not at the federal, then the state level. But the point is, we know it's coming. So, let us help you achieve your regulatory objectives without you unnecessarily burdening the already overburdened. So it's not, we want more regulation, please. It's, we know it's coming. So now let's work together so you can achieve your regulatory objectives and, without really, really hurting these folks who are already heroes. I mean, they're on the front lines. Sure. It's in a way, it's kind of getting worse more than it's getting better in the sense that there's such a mass exodus from the sector, and it's hard to fill those jobs, and you have agencies that are frankly gouging the skilled nursing facilities and the SLAL facilities. So there's just a lot of stuff that would, I think, lead you to believe that if you want to achieve your regulatory objectives, it's probably the right time to be really efficient, if you will, on how you get there.
Mm-hmm. Yeah, and many of them weren't even glorified in their job. In fact, during COVID, they were kind of demonized.
They're demonized, right? Oh, some of the
kind of crazy.
It was vitriolic, right? Some of those early headlines were just
sure. But what can someone in the sector do to kind of impact Washington, to educate them? There was one from stage, I'll still, bring them to your facilities. That makes sense, right? It opens them to the humanity of what's really happening. But what other advice would you have for them to kind of make an impact in the regulatory?
So that's a great question. So I was brought to PointClickCare to actually engage health systems in the publicly funded systems like Ontario and frankly the rest of the world. Canada, and the rest of the world. Where you can engage ministries of health, ministries of long-term care, as well as governments to help them understand their priorities and show that, for the ones for which you have solutions, and then you get funding envelopes created for your customers' benefit. And then I said, I've got 1 month on the job at PointClickCare, went to Mike at the time, Wessinger, and said, this is a highly regulated industry. We really, we really have an opportunity here to shape the rules of the game, as we call it.
Absolutely.
And, those policies, rules, and regulations that govern everything that folks, especially in SNFs, do, and increasingly in SL and AL facilities. Anyway, and Mike said, great, that's your job. So look, PointClickCare is not moving the needle on its own. I don't know if there are too many companies in the world that can change laws on their own. We're certainly not one of them. And so for us, it's an exercise of working together with others. And it starts with the owners and operators of the facilities, and extends through to the associations like ACA and NCAL and NASL and Argentum and Leading Age, the Ambassador Group, folks that can really amplify the voice of, and this is the ultimate warrior in this, which are the owners and operators. And their story, that narrative is so powerful. It leaves us scratching our heads as to why it doesn't land more easily with certain parts of the policymaking environment. But it's characterized by empathy and resilience and compassion and excellence and hopefully innovation, right? So there's a real narrative there. And what we're doing with our customers and with the associations in true partnership is setting them up to tell that story, because nothing is more powerful than it coming from those people, those heroes on the front lines. We're just people on the side, right? Those folks telling their stories to elected and unelected officials can really have an impact. So invite them to your sites. And you hear it from the associations too, right? Like invite your local representative, right? At whatever level, state, federal, Congress, House, Senate, whatever it might be. Have them come down to your site, because all it takes is one visit to really open people's minds. But you can't assume that they know anything about the sector. And
because they don't.
Because they don't, right? But it's so interesting, right? Because we all have parents. That's maybe that,
But many of them have been through it, right? And seen it.
And so that's the education part. And it's so impactful to have the story come from the people who are delivering that incredible care on the front lines. And that's what we're trying to get people to do.
What a great story. So are there any other policies or regulations that the sector should kind of be keeping an eye on? You mentioned information blocking, which I think is interesting. Price transparency on the acute side. What are the things maybe you're keeping an eye on? Yeah,
I think, so look, anything that's driving interoperability, we're kind of pro interoperability, right? So one of our fundamental theses is we want the LTPAC sector to become part of the health system. So instead of it being, acute and post-acute, it's the whole care continuum that includes LTPAC. So we watch things like TEFCA, like initiatives for national interoperability, watching to how that unfolds. We are very interested in things that can be done, I think, probably at the federal level when it comes to staffing mandates. So look, there's a lot of talk about unfunded staffing mandates coming out of Washington, and that would be crushing for this group of people. There's no ifs, ands, or buts about that. If somebody decides that in the face of everything that they're hearing that this sector is facing, that the right thing to do is to create a 24/7 staffing mandate without support, without funding support, that is a bad idea, and they shouldn't do that. That is not going to, again, it's to the point, it's not going to achieve the regulatory outcomes that they want, right? It's not going to increase care. So we're watching that. The agency gouging is really difficult, and we're trying to find, how do you have that conversation? I mean, look, we're free marketers, right? But this doesn't seem fair. These are people who are already subject to regulation to such a degree that, I'm not sure SNFs really operate in what we would all consider to be a truly free market. So if that's the case, how come it's okay for agencies to really be taking advantage of these folks and charging exorbitant wages for their people to help out? So there's a lot of different things happening that we continue to watch. But I think, for our company anyway, we're very careful to focus on, stick to our knitting, right? Pick your metaphor, stay in our lane. For us to just kind of add another pair of arms and legs to the a long list of issues that the associations handle probably isn't where we have our biggest impact. And I don't mean from the corporate perspective, I just mean in the discourse. So we focus on the technology, we focus on the data and the data insights, and that's the place that we found that adds real value to the association's work and can have the most impact.
Yeah, makes sense. Well, Bill, this was a lot of fun. I really appreciate you educating me and the Healthcare IT Today community about this. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for Healthcare IT Today on your favorite podcasting application. Thanks, Bill.
Thanks very much.